Hello, everyone. This is Dr. David Pascal at the Pascal Health Institute in beautiful Cary, North Carolina. We are coming up on springtime here, hopefully soon. It's a gorgeous sunny day today, although I hear tomorrow we may be down into the 20s again. Kind of a roller coaster of weather as we do our winter to spring transition, always in the Carolinas. But regardless, we are here, it's beautiful, and today I'd like to talk to you about something that is a concern to many people, and that is there a genetic connection to complex regional pain syndrome? Can CRPS be genetic? And I can tell you the short answer from all of the research is no. They have not found a definitive genetic link. And in my own experience, all the years that I have had treating people with CRPS, I have only had one family where there was definitely multiple family members had CRPS. All the other people that I've treated have been, they've been the only person in their family with CRPS. So what does that really mean, and why do people even ask that question? I don't really like that question. People come to me all the time with other conditions besides CRPS, and they go, hey, could my XYZ be genetic? And I found that the main reason why people are asking if their problem can be genetic is almost like, okay, well, if it's genetic, then there's nothing you can do about it. And then that kind of lets people off the hook on how they can address it. But also it means if they do have something that is well known to have a genetic component to it, that that means they're definitely going to get it. And that's the part that I don't like. I don't want people to go, oh, well, I have this gene marker for XYZ disease, and therefore I'm going to get it, and they fall into this victim role. And that's a very terrible and dangerous place to be. I always equate genetics to kind of like where you live. If you live in a town where the crime is very, very high, right? There's a lot of criminal activity throughout the day, at night, and you go into your house, or maybe let's say you are in an apartment and you park your car on the street, and you wake up at 3 in the morning and you go, oh my gosh, I just realized I left my wallet or my purse in my car. If you live in a very high risk crime area, then you go, you know what? I'm going to wait until the morning to go retrieve my purse or my wallet because you live in the dangerous area. If you happen to live in a place with a very low crime rate, low crime area, you're in an apartment, your car is parked on the street, you wake up at 3 in the morning and you go, oh gosh, I just realized I left my wallet or my purse down in the car, then what do? You just go outside and get it, right? Because you live in a very low risk, low crime area. So what's the difference? Same scenario, in both cases, people are living in apartments. In both cases, they left their purse or wallet in the car. In both cases, their car is parked on the street. In both cases, they wake up at 3 in the morning and realize that their purse or wallet is in the car. But in the first example, that person lives in a very risky area, so they modify their behavior. They modify their behavior to lower their risk of becoming a criminal statistic, right? The person that lives in a low crime area, they don't have to modify their behavior. They are at low risk of anything bad happening to them. And to me, that's what genetics is all about. Just because someone has a genetic marker to something does not mean they're going to get it. We all know plenty of people where there's a clear genetic marker, there's a family history of XYZ disease, but you can point out numerous people in that family with the same genes that do not end up with that disease. Why is that? If if the mere fact that you have those genetic markers mean you're going to get that disease, then that wouldn't be the case, right? That is everyone that jumps out of an airplane without a parachute, from 10,000 feet up in the air, ends up going splat when they hit the earth. That's how that is, 100%. That's not what genetics is. Genetics is you live in a high crime area, you are at risk of getting mugged or robbed, so therefore you modify your behavior. You tend to look both ways when you're out and about in that neighborhood. You make an extra effort not to leave your purse or wallet in the car. And if you realize that you did leave your purse or wallet in the car, you certainly do not go get it. So that's the way I view genetics. You are predisposed, right? You're predisposed to cardiovascular disease or breast cancer or whatever it is. So what does that mean? That means you lose some options. If you're in that high crime area, you lose the option of going out to your car whenever you want to, if you don't want to get hurt, right? If you have a family history, genetic marker to breast cancer, for example, then you lose the freedom of eating junk food all the time, of not getting enough sleep, of having whatever mental attitude you want, of living in whatever kind of environment you want. Because we know that your mental attitude, the food you eat, getting sleep, exercise, all these different things have a major impact on your immune system. And if you already have a genetic marker that predisposes you to cancer, then you need to live a little bit tighter. And lo and behold, those people that live a little bit tighter, all of a sudden that marker does not play a role. So that's why I don't like when people are so concerned of, well, I have this genetic marker, and that means there's nothing I can do about it. What it means is there's a lot you can do about it, but you do have to be proactive. Back to CRPS, complex regional pain syndrome, we know that only a small percentage of people with CRPS are going to respond to drugs, are going to respond to some type of surgical procedure like a nerve block, a nerve ablation, spinal cord stimulator, right? Something like that, 20 to 30%. The rest of them, doesn't matter how many drugs you give them, doesn't matter how many nerve blocks or, spinal cord stimulators you put into their bodies, they are still going to have all of their symptoms. They are not going to be in remission. Why is that? You've all heard me before. It's because it's not just that peripheral nerve. It's not just that nerve going from that ankle that was broken up their leg to their spinal cord, carrying that pain signal on to the brain. That's not the issue. If it was the issue, if you cut the nerve, drug the nerve, block the nerve, then the pain will go away. But in 70%, 80% of the cases, that doesn't happen because those people have other factors, right? We've talked about this. Almost all of them have a hormone imbalance. Almost all of them are highly sensitive people, right? They, even as a little kid, they were sensitive to smells or tastes or textures, right? Almost all of them have an autoimmune disease. Almost all of them have sensitivities and or allergies. Almost all of them do have a nerve problem, but the pain is being generated in their brain, right? The brain, the sensory part of the brain. So sensory, that's information coming in to the brain. The sensory part is more environmental stuff for the most part, right? Like the temperature, how much pressure, the light touch, deep touch, circumferential pressure, is there vibration there, right? Is there, where is the joint? That's more of an internal thing. We all know where our left ankle is, even though we're not looking at it. That's because every joint in our body has a certain receptor responsible for joint position. So that's proprioception. So all of these sensory nerves, and there's a few others, they're sending information to the brain saying, hey, this is what's going on with the body, including pain. But in complex regional pain syndrome, instead of taking just the pain signal to the brain. The brain is taking in the light touch, the vibration, the circumferential pressure, form recognition, all these other things, and it's turning part of that information into the perception of pain. So now the brain is perceiving very high levels of pain, not coming down that pain pathway. The brain itself, the brain tissue itself is converting the signals into the perception of pain. So all of these things all add up together, and now the person has CRPS. When we look for a genetic predisposition, and they've been looking for years and years and years, all the research scientists, they have not been able to find a definitive marker. Even with autoimmune, I mean, lots of people have autoimmune disease, but most people with autoimmune disease do not have CRPS. However, most people with CRPS do have autoimmune. So we know that autoimmune problems, that's a problem with our immune system. A lot of that can be genetic, right? Autoimmune disease can be genetic, but autoimmune issues, in other words, a problem with your own immune system where your own immune system is attacking itself, that is not the 100% cause of CRPS, thank goodness, or we'd have 100x the number of cases of complex regional pain syndrome than we do. So some things have, lots of things have a genetic predisposition. Lots of things, or most things, do not have a genetic predisposition. It's just what we call cumulative stress, right? It's a little bit of this, a little bit of something else, a little bit of something else. It all adds up to cause the body to finally break down, create all this dysautonomia, this dysfunctioning of the nervous system, the immune system, right, endocrine system, all the different parts of our body are all breaking down, not from one thing, but a whole bunch of things all adding up together, causing the collapse. So I hope you found this little talk on the genetic connection between in regards to CRPS helpful. And I am on here, Facebook Live, filming these things every other week. If you have any suggestions for a topic you'd like to hear me talk on, go ahead, write a comment below. If you liked what I said, please let me know. Again, if you have any questions about anything, you can always comment below. You can call our office, 919-380-8000. You can go and send us an email at drpascalhelps@gmail.com. You can reach out on Facebook. You can track us down on Google. You know, we are pretty easy to find. You can call us, text us, email us. Always glad to help where we can. And I look forward to speaking with you all in 2 weeks. Thank you very much.